A warm good morning to everyone. I'm Dr. Swati, Ayurveda expert at Fertility Dose. So I hold a master degree in Ayurveda, obstetrics and gynecology. I have worked in various Ayurvedic colleges, Ayurvedic clinics and setups. Today I take my pleasure to talk about male infertility and how Ayurveda can help in treating and preventing the male infertility. To start with, male reproductive health refers to a man's ability to procreate and to bring a living being into the existence. Male reproductive health has social, psychological impact on the normal life. To conceive a child, we know a healthy sperm and a healthy ovum is utmost important. So, a man's sperm must combine with the woman's egg. The testicles of man make sperm and store the sperm. The testicles produce and store the sperm, which are ejaculated by the penis to deliver the sperm to the female reproductive tract during the sexual intercourse. This is how the natural process of conception or ejaculation takes place. The most common issue that leads to the infertility in men are the problems that affect how the testicles work, because that's the main production unit, we can say. The problems may arise from the testicles or from the hormones which are responsible for the growth and the maturity, or the blockages in the male reproductive organs. In about 50% of the cases, the cause of male infertility cannot be determined. I'm going to repeat this. In the statistics says that about 50% of the cases, the cause of male infertility cannot be determined. So, since I'm talking about the statistics, I want to give you a more picture in that regard. In the last 50 years, a significant decrease in the human fertility has been observed. Last 50 years, significant decrease has been observed. It has also been stated that 15% of the couples have fertility issues. Among these infertile couples, it is a man who is responsible for the 50% of the cases. So, a man is responsible for the 50% of the cases, and also the studies indicate that 6% of men aged between 15 to 44 years are infertile or their fertility is significantly compromised. The studies indicate that 6% of men aged between 15 to 44 years are infertile or their fertility is significantly compromised. So now we know how vast or serious this issue is in regard to the male infertility. The causes for the male infertility can arise from the issues related in the testicles, that is the storage unit, or from the blocks, tubes which transfer the sperm to the penis. There might be the blocks in the tubes, and there can be an issue related to the ejaculations. So these are the areas where the production and streamline is focused on. Again, in regard to that, we spoke about the production and about the quality and the quantity of the sperm also holds a major, or on a larger scale, it also has a major role to do. Reports in the recent years have shown that incidence of male infertility has increased as a result of various factors. The factors responsible for the increase in the incidence of male infertility are environmental pollution, stress, and the lifestyle. The stress and the lifestyle are, I can say, the utmost two devils responsible for causing the male infertility, whereas the environmental pollution also holds the major role. Whereas as an individual, working on the environment pollution would be a very long task, but certainly a couple or a man has a complete hold on the other two factors, that's the stress and the lifestyle. The amount of stress the body or the mind takes has direct involvement in the production of the sperm and on the act itself. Stress and lifestyle is or must be addressed immediately, and it should be corrected. Again, in talking to the terms of the lifestyle, so we have known the various causes or the faulty lifestyle habits. Maybe messing up with the biological clocks, that working at wrong hours, sleeping at wrong hours, eating at irrelevant times, or eating the food substances which are not acceptable to the body and to the place where you live, and eating the food which are opposite in combination, mixing hot and cold types of food. All these factors in a long run is going to affect the health, and in turn will also affect the fertility rate of a human. Maybe it's a male or a female. So let us again talk more about the causes. Several lifestyle causes, as I said, are attributing to the male factor of infertility. Psychological stress, as I just said it, the stress hold a major part. The stress in regard to inability to conceive, the family stress, the work stress, stress to reach on time, stress to finish the things on time. All these things are going to increase the stress hormones in the body and in turn affect the sperm count and the motility, and in turn, to put it into a simpler words, I can say that that affects the semen quality of a man. Genital heat stress, that's an important term here. That's the genital heat stress. So the production unit of the sperm is outside the body. The testicles are outside the body. So they are outside the body because of a certain reason, because to maintain or to have a lower temperature in comparison to the body, so that the production and the manufacture takes place very well. So the testicles need a lower temperature to produce the sperm in a very good quality and quantity. So the lifestyle or the actions, whichever causes increase in the genital heat, can cause issues in regard to the sperm. How these factors possible would be sitting for the prolonged period, wearing tight clothes or wearing the clothes which are not suitable to the season, severe prolonged exercises which the body cannot handle, or I can say the excessive exercises or gymming. These are all the factors directly increase the genital heat and causing the stress in the testicles, which causes the issue. Smoking and alcohol, as we know, they also form the issues. Smoking and alcohol are also the points which has to be considered, where they directly affects the semen and the sperm count. These are all the responsible factors for the decline in male reproductive health, directly or indirectly. So the causes, if you can see, where all it can hamper, the points would be defective spermatogenesis, that there is a defect in the formation of the sperm. And why there is defect, it would be a congenital reason or the congenital issues like in certain syndromes where the genetic composition itself is absent for the formation of the sperm, autosomal or the chromosomal diseases, hypospadiasis. Hypospadiasis is a condition where the opening is on the other side of the penis, where the high end deposition of the sperm is not possible in the vaginal canal. That is, in hypospadias, a couple cannot, or it will be very difficult for the couple to conceive naturally. Thermal factor, yes, the occupation and the lifestyle habits play a major role in the thermal factor. Infections, various infection to the genital organs, causing the issues in the production and the quality, of course, the quantity as well, and other factors. Other factors here, what I would like to mention is any other systemic diseases like diabetes, hypertension, thyroid dysfunction, or maybe any cancerous conditions which causes issues in the production of this sperm. How can we identify the issues, or how can we know that there is issue in the um, sperm? So mainly the most easiest investigation to be done for this is the semen analysis. So which has to be undergone by every couple who is trying to conceive, just to know the quantity and the number of sperms present. So these were the causes what I just mentioned were is explained by the allopathic science. So did Ayurveda talk about the male infertility or in regard to the increasing the function of male fertility? So yes, because Ayurveda has spoken or has touched on the every aspect of the humankind. So to understand the Ayurvedic causes, to name them, it starts with the Shukra dosha. So here the term Shukra means the sperm or the semen. So any abnormality or any issues in regard to the Shukra. So that might be in terms of the count, or it might be in terms of the motility, that is the swimming capacity of the sperm, or with the anatomical structure, the structure of the uh, sperm, which is at most important. And again, one more factor which will affect the semen is Ati Vyayama, as said in Ayurveda. Ati means increase, Vyayama is exercise. So, increase in the body exertion, increase the body exertion, or too much of exercise, as I just mentioned, too much of exercises, gymming, not knowing one's own capacity to stop, or not able to identify when to stop exercising, which causes debilitation, and again the end result is decrease in the sperm count. Ahara dosha, faulty dietary habits, eating in the wrong time, eating uh, opposite combination food, and the food what you consume is not suitable for your prakriti, that is the body constitution, and to the desha where you live or the place where you reside is not able to take up the food very well. Vihara dosha, untimely sleeping habits, waking habits, sitting habits, and the work atmosphere or the postures. Loss of bala or strength. That's the loss of the bala or strength. It can be again because of the malnourishment or because of any diseases. Manasa dosha, that's an important factor where the psychology of a couple or a man holds a very big place in, or in causing the issues in regarding to the sperm. So, Manasa dosha is one important factor, or which is exclusively said in Ayurveda in regard to the male infertility. So, I just want to tell the points again. Shukra dosha, factors responsible for the anatomical count and motility of the sperm. Ativyayama, increased exercise and the causes. Ahara dosha, the food what you consume is not right to you. Vihara dosha, your lifestyle is not suitable. Loss of bala or strength, emaciation of the body, manasa dosha, everything is here. Or the stress which is causing, or how the psychology of a person, how it affects the fertility. An important factor to discuss here, along with the male infertility issues, would also be ED or the erectile dysfunction. So, what Ayurveda has spoken about erectile dysfunction? So, sexual dysfunction characterized by inability of a man to perform the sexual act is called as clivia. So, the word used in Ayurveda is clivia, or you can, in normal English terminology, we can call it as loss of libido or impotent in a layman's language. So, the main causes for these is stress, mental health issues can or worsen the erectile dysfunction. Sometimes combination of physical and psychological issues causes ED. For instance, uh, easy example would be a minor physical problem that slows the sexual response may cause anxiety about maintaining an erection. So the resulting anxiety can lead to or worsen the erectile dysfunction, which is actually very minor. So again, there are six types of ED. Bija upagata. So if there is any injury to the basically a congenital anomaly, or dvaja upagata, which is caused by excessive intercourse, we can say. Shukra Shayaja or the oligospermia, these are the one of the causes where there is deficient in the Shukra, or there is the resultant Shukra is very less, where ED is one of the resultant there. Jara Sambhavaja, that's as you age, it's very common, or it is a physiological process to have erectile dysfunction. Sahaja clivia, that's it is congenital or not able to process the things. Kara Shukra Nimittaja, that's again because of the other factors, any other causes which are causing clivia or loss of libido. So the Ayurveda has given a various understanding for treating the conditions, and also the treatment on how to process or how to move forward in treating yourself, treating from infertility. So how many of these types, or these types of male infertility are curable, or as per Ayurveda? So Ayurveda has said that Dvajabanga, Janmajata, and Kshayajanya Clivias are asadhya. So the one impotency which is caused due to an injury or the congenital aspects of infertility or impotency are incurable. The rest types which I have mentioned are curable through Ayurveda and Ayurvedic science. So again, the erectile dysfunction or clivia is also found as an associated conditions in many other diseases. So you do not have any direct disease in the genital organs. So clivia can also be an associated condition in regard to other diseases like grahani, arshas. So these are the conditions where, if I have to translate them into a common English terminology, it would be sprue, piles. These are the conditions which also affects, or which also has a direct relation to causing loss of libido. So if a person is suffering from maybe sprue or piles, then we can understand that the conditions in regard to the fertility is also compromised. So, what are the treatment aspect which Ayurveda can offer here? So, first and foremost thing is Patya Ahara, that is setting up the right diet and the lifestyle, following the charyas, that is Dinacharya, Rutucharya, Traya Upastamba Palanas, and Achara Rasayana. So, Ayurveda has a clear cut mention about how a day should be processed, what time to be woken up, food intake and the exercise, when to stop exercise, when to eat, how much quantity of food must be taken. These things are very elaborately described in Ayurveda. And again, the charyas, that is the Rutu Charya, that means the lifestyle or the practices will be changed as per the season. Like for example, in summers, the following or your day-to-day activities to be followed is comparatively different from the one in winters. So summer times is also contraindicated for sexual intercourse because summer is already debilitating. It already removes so much of energy from your body. So at this period of time, indulging intercourse is contraindicated as per Ayurveda because again, performing the act will also lose energy, which will make you weaken or which will make your body tired in the sense, weaken in the sense tired. And to overcome that, you need to have a nourishing food which will help in overcoming the lost energy. That what is meant in this context. Shamana Aushadhis or the medicines, intake of the medicines, almost all trying to conceive couple and almost everybody are aware of these single drug formulations like ashwagandha, musli, shatavari, shilajit, kapikachu, and gokshura. These are the very effective single drug which are used in improving the fertility in man. Along with these single herb compounds, there are also the compound formulations in Ayurveda which help in overcoming the fertility related issue and enhancing the quality and quantity of the sperm. Last and the utmost mode of treatment which can be utilized is the Panchakarma therapies, which help in cleansing or the detoxifying and rejuvenating the body. So, Panchakarma is one such procedure which helps in the process. So, I have certain research points to support um, the benefits. So, Putran Jivaka is a one such drug which has found highly significant effect on all the sexual parameters. So, Putran Jiva Rockbergy is the anatomical name. So, one more study where it indicated that Basti, the procedure which is done in Ayurveda, which is highly useful in reducing the symptoms of a chlamydia, that's reducing the symptoms of erection and the lack of rigidity. In one more study, it was found that the patients of erectile dysfunction along with diabetes, when treated with the powder of F. religiosa, have shown moderate to significant improvement in the diabetic subjects. So Ayurveda has also role in improving the impotency caused due to other diseases as well, like diabetes or hypertension. So, these are the conditions or the things which Ayurveda can offer. Again, to put it further, I would like to say that Ayurveda can offer in regard to male infertility by addressing the simple lifestyle factors and providing Vajikarana remedies. So, Vajikarana remedies means the one which will improve the virilization in the body offered in the Ayurvedic text. Yes, the Ayurvedic practitioner or the registered Ayurvedic doctors can help in optimize their fertility. Thus, we can conclude that there are large number of factors that lead to male infertility, but with the right precaution and Ayurvedic cures, this medical condition can be treated very positively. So, all which you need to follow is a balanced diet, proper lifestyle habit, and the right medical assistance. So, the medicines or a single herb of Ayurveda or basically any herb should not be consumed over the counter. The Ayurvedic principles are life principles or the life science which must be consumed only after discussing your issues with an Ayurvedic registered Ayurvedic practitioner. So we can take up the questions. So we have a question from the viewer. How exercise and low sperm count are they related? Yes. Excessive exercises can cause a decrease in the sperm count. So basically, how it is working is uh, a person should exercise up to his half energy or up to his half body strength, and the exercise must be stopped when he starts severely sweating or the time once he starts getting dyspnea. And in summers or in the Grishma Rutu, the one which is going on currently, exercises should be done moderately. So yes, the exercises are going to severe exercises are going to cause issues in regard to the sperm. Yes, being on the overweight, the one more question what we have is please suggest if weight could be the reason for male infertility. Yes, weight can directly affect the male infertility, varying from the decreased count, and the increased weight may indirectly increase the genital heat stress by causing reduction in the count and motility. And as we all know, because of the increased weight, performing the act is also discomfortable. So reducing the weight would be an ideal thing, but how to reduce the weight? You have to opt for a sustainable plan to reduce the weight. So the one more question what we have is what is the standard and minimum required semen count and motility, and what is the adverse effect of bad sperm on healthy sperm? Yes, the standard and the minimum required sperm count and motility. Now, what the WHO says in regard to this is the standard semen count per ejaculation, that is about from 3 to 5 ml, it should be more than 15 million. So the ejaculation, every ejaculation should have at least the minimum what it is says is 15 million sperms, and the motility of these sperms should be more than 70 to 80%. The motility or the swimming capacity of the sperm should be more than 70 to 80%. And what is the adverse effect of bad sperm on healthy sperm? As such, we cannot say that the bad sperm will be influencing the healthy sperm. The body is made such that during the natural conception, this bad sperm will not be able to enter the uterine cavity itself. Only the best ones will be able to reach the fallopian tube and fertilize the egg, fertilize the healthy ovum there. So we cannot say as the bad sperm will influence on the healthy sperm, but somehow maybe 1% of the chance, if this bad sperm uh, is able to fertilize an egg, then that embryo may end up being an embryonic gestation or miscarriage. Again, if it went on further, there might be issues in regard to the congenital anomaly in the fetus. So, to have a miscarriage or the congenital anomaly, sperm also holds equal fair play as in regard to the ovum. So, how much we stress on healthy ovum or how much we say that healthy egg is required. Here, egg, we must consider it's always ovum and sperm. So, it it is or it holds a very big place in regard to miscarriage, congenital anomalies, or any other diseases which a neonate or which a fetus can be affected with. Yes, any Ayurvedic medicines for no ejaculation during intercourse? Yes, we do have medicines as I've just explained now. The reasons would be various. We need to understand why it is happening and since when it is happening, that there is no ejaculation. So, yes, we can work on this. Please connect to us. We can work on this factor very well. No, so is by any means regular masturbation is associated with male infertility. So the points to be considered here, I think I can answer this as yes and no. The points to be considered here is if you are into a regular masturbation or into a regular intercourse as such, the body must be supplemented with the medicines or with the food or the drugs which help in improvising the fertility aspect. The food what you consume must be helping in improvising the sperm production, I can say. Otherwise, if you're eating well to what your body needs, there will be no associated side effects because of regular masturbation. If your nourishment or if the lifestyle is not good and if there is only depletion, that's if there is only depletion of the shukra, then yes, this is going to cause or this is going to cause reduction in the strength, which is one of the type or which is one of the type mentioned for the cause of impotence. So this is to keep a very perfect balanced diet. Your balanced diet means your plate, the food or the meal should be consist of all the six rasas and a proper lifestyle habit. Here, the lifestyle habit will include your dinacharya, ratricharya, rutucharya, traya upastamba palana, and the acharya rasayanas, which I just explained sometime back. Yes. What are the signs of male infertility? So, to know about or to understand about the impotency, we can say that unable to perform the sexual act, the clivia, as mentioned as one of the type of infertility in Ayurveda, or if, or again, not able to deposit the sperm in the high end of the vagina. There is no proper erection, so there is no proper ejaculation or the premature ejaculation, where the ejaculation happens without any control of the man. And the other signs would be decrease in the count, decrease in the quantity, that the volume of the semen is less, number of sperms count is less. There is Abnormal morphology, that's the shape, head, neck, and the tail part of the sperm, they are abnormal. Motility is affected, that's again one of the factor to be considered. So to understand these parameters, as I said, the count, volume, pH, and the motility, all these can be assessed with one simple investigation, which is called as the semen analysis, where a man should give the sample of his semen after 3 days of abstinence for a detailed analysis. So, with that one report, we will be able to assess whether there are any issues in regard to the count, motility, pH, morphology, etc. If a male is unable to perform the act, then we know it falls under the category of the chlamydia or the impotence, and there are the other reasons to assess the same. So, if you want to join our male infertility program, please connect us on 99713 or you can also directly message us in Instagram and our Facebook page with our Instagram and Facebook handle Fertility Dose.